A study finds that close to 3 in 10 gout patients in Singapore have poor control of the disease. Now, gout is a painful condition affecting the joints. Poorly controlled gout are those with 2 or more gout attacks within a year. The study by SingHealth Polyclinics also finds patients were not receiving the right amount of allopurinol, a drug used to treat gout, if they were even prescribed it. Now, to explain further, Dr. Prawira Oka joins us in the studio now. He is a family physician from the SingHealth Group and the study's author. Dr. Oka, welcome to the program.
Thank you so much for having me.
So, nearly 30% of the patients surveyed had poor gout. And your study says that they may not be receiving the right amount of allopurinol. Why do you think this is the case?
Yes, certainly. So for our study, we actually found that 46% of patients had poor gout control. And among these patients, they were not actually receiving any allopurinol. And there are 2 main reasons for this. We suspect that the first cause is actually because patients are not keen to be on the medication. Secondly, there is a great fear of potential side effects that patients have regarding starting allopurinol.
So we'll talk about allopurinol in a while, but what is the impact to a patient who is not getting the right amount of this particular medication?
I think it's important to really define the role of allopurinol. In patients with gout, management transcends medications. It also includes the importance of dietary control. Of course, we have some patients who, despite their best efforts with dietary control, are unable to control their gouts, and we have to then leverage on medications to control their gouts.
Earlier, you were saying that these patients may not be interested to take this prescription. Why do you think that's the case?
I think the challenge with gout is that it's a chronic relapsing illness, which means to say that it really only afflicts individuals when they have an acute flare. So for many patients, they adopt this out of sight, out of mind kind of mindset. They treat the acute flares with pain relief, anti-inflammatories, but they don't see the role of really taking daily medications to prevent it.
Are there other alternatives besides allopurinol that can actually help them?
Certainly. So to control gout in the long term, there are 2 main classes of medications. One is to reduce the amount of purine or uric acid that's being produced in the body. Second would be to increase the urinary or renal excretion of uric acid. So allopurinol represents one of the types of medication to reduce the amount of purine, basically breakdown, that results in the increase of uric acid.
How safe is allopurinol in the first place, and are there any side effects to this medication?
Yes, so allopurinol is fairly safe as a medication. However, it is associated with a rare side effect. One of the side effects that many people fear is a rare side effect called SCAR, or severe cutaneous adverse drug reaction, which can manifest as a severe allergy and result in ulcerations in the mouth and even in other aspects of the body.
And what would be the long-term impact of this particular condition?
I think it's important to highlight that this particular side effect is fairly rare. It occurs in approximately 2 out of 1,000 patients who are given the medication. And this is based on the HSA's data. And in fact, this is why we need to start the medication at a low dose and monitor closely in these patients to make sure that it doesn't manifest in such a severe state. Because many of these patients first present with a rash before it then really evolves into this more severe allergic reaction.
Okay, and earlier we were talking about the alternatives, right? There are the other alternative medications. Are they safer than allopurinol?
Generally speaking, they're about the same. And in fact, across the world, across the different organizations that manage or recommend treatment options for gout, allopurinol remains the first-line therapy for patients with poorly controlled gout.
Okay, why is that the case?
Because it's the most efficacious in terms of improving a patient's gout control, as well as it doesn't have any, increased risk of side effects compared to the other groups.
Right, okay. And we understand that there will be a refresher on the prescription of allopurinol. Could you share with us what are some of these efforts?
Okay, so I think first we need to go back to some of the challenges that we face with regards to initiating and even titrating or adjusting the dose of allopurinol in patients with poor gout control. And one of them is really this potential erosion of the therapeutic relationship between patients and doctors. Because in the clinic, in the busy clinic, sometimes you may not end up seeing the same doctor every time. And we know from previous studies across the world that patients really value continuity of care, being able to see at least the same familiar faces same team to manage them, who know their condition. And I think this is really the crux of how we can better tackle gout control by developing long-standing relationships with our patients through coordinated care and continuity of care. And this can help them to better understand our point of view and understand our explanations with regards to potential rare side effects that can happen, and maybe make them more amenable to considering these options. And in fact, this is in line with the national HSG or Healthier SG program and our institutional efforts to improve continuity of care. So we have what we call a MyCare team. And within the MyCare team, we have a whole host of healthcare professionals, including doctors, nurses, as well as dietitians, who work collaboratively. And through this collaboration, it provides also an opportunity for discussion with regards to complicated cases. Maybe a patient has poorly controlled gout that we don't seem to be able to have a handle over. This is where the senior and the junior doctors, together with the allied health professionals, actually can come together and actually come up with a plan that is amenable to the patients.
Okay, and your study also recommends that interventions should focus on male and Malay patients. I mean, what causes gout in the first place, and why is this specific demographic more prone and vulnerable to gout?
Okay, so gout actually is a crystal disease whereby the uric acid level in the blood reaches a certain point where it starts to precipitate as crystals in the joints.
Okay.
It tends to happen in areas in the extremities as well as those more prone to gravitational forces like your legs and your toes. So what happens is once the crystals form, it actually elicits this inflammatory cascade, which results in swelling, pain, redness, basically become very debilitating for the patients. And in our study, we found that, number one, male patients were more likely to have poorly controlled gout. This is actually quite consistent with other studies done across the world, because we know that females with estrogen being higher in them, they actually have a higher excretion or urinary outputs of uric acid, which then reduces their risk of having gout flares. Secondly, studies have also shown that females are actually more likely to take allopurinol on a regular basis compared to males. So this could be an additional reason why. With regards to the the Malay ethnicity being a potential risk factor for patients having poor gout control, unfortunately, the mechanism really is quite unclear at the moment. And we look at our neighbors in Malaysia as well as our local studies here. Usually, we still tend to see Chinese as being a risk factor for having poor gout control instead of the Malay demographic. And there are some very clear explanations as to why the Chinese have a higher proportion of poorly controlled gout. Generally, it's in relation to their consumption of certain red meat products, such as pork, and consumption of alcohol.
It's down to the diet, yeah? That plays a huge part in this. All right, Dr. Oka, I wish we could talk more, but we've run out of time. But thank you so much for coming in to talk about this. That was Dr. Prawira Oka from SingHealth Polyclinics.